Welcome to Study Neuro. In this session, we'll focus on cranial nerves 9 and 10, the glossopharyngeal and vagus nerves. You'll learn how to assess gag reflex, voice, and taste at the bedside, and how these findings help localize brainstem or lower cranial nerve lesions. We'll also highlight common clinical signs of dysfunction and walk through practical examination techniques you can use in real clinical settings. By the end of this video, you'll have a clear, structured approach to evaluating cranial nerves 9 and 10 with confidence.
When examining the glossopharyngeal and vagus nerves, we are primarily assessing the function of the palate, pharynx, and larynx. These nerves are essential for symmetric palatal movement, normal voice quality, and safe swallowing. Begin by asking the patient to open their mouth and say, "ah." Observe the soft palate as it elevates and the uvula for symmetry and midline position. Listen carefully to the patient's voice, noting any hoarseness or nasal quality, which may suggest vagal dysfunction. Testing the gag reflex is optional and should only be performed if clinically indicated. If you do test it, gently touch the posterior pharynx with a tongue depressor or cotton swab, and always explain the procedure to the patient beforehand. Throughout the exam, compare movements on both sides to identify any asymmetry. Normal findings include symmetric elevation of the soft palate, a midline uvula, a clear, non-hoarse voice, and a present gag reflex if tested. Clinically, asymmetric palatal elevation or uvular deviation indicates ipsilateral vagal weakness. Voice changes such as dysphonia or nasal speech also point toward vagus nerve involvement. While absence of the gag reflex alone is not always pathological, these observations are important for localizing brainstem or bulbar lesions and for assessing swallowing safety. So that wraps up cranial nerves 9 and 10. These nerves play a huge role in swallowing, voice control, and autonomic function, and examining them properly can give you valuable clues about brainstem or lower cranial nerve involvement. If you found this helpful, drop your key takeaway in the comments, and don't forget to like and subscribe for more clear, clinically focused neuro content. More coming soon. This is Study Neuro, where neurosurgery is made simple.